Today we'll be discussing informed consent and confidentiality. Informed consent is both an ethical and legal requirement. So it's required by the ethical code of your professional organization as well as by the laws of your state. This is a process where you explain therapy to the client, let them know what to expect, let them know your responsibilities, their responsibilities. You make sure they're fully informed so they can make a decision about whether or not they want to participate in this process. And make sure you don't just treat this as a formality. This is where you're beginning to create your working alliance with the client. You're letting them know that your relationship will be collaborative, that you'll be upfront with them, that you'll let them know what to expect, and allow them to make their own decisions about participating every step of the way. So make sure you don't just sort of dismiss this process. So what should informed consent include? It should include the goals of counseling. Now, at the beginning of your relationship, you won't know the client's specific goals, but you'll know the general goals of counseling and you'll need to explain those to the client. Things like the fact that you're not going to give them advice. You're not going to tell them what to do or suggest what they should do. Let them know that your role is to work with them through the process of exploring their own beliefs and their own values and arriving at the conclusion that's best for them. Because some clients will come in thinking that you're going to give them advice. So make sure they understand the general goals of counseling. You'll let them know their responsibilities as well as your responsibilities, the limitations of confidentiality, which we'll talk about in a little bit, any legal or ethical parameters of the relationship. And so this is important because there will be aspects of the laws surrounding your relationship and the ethics that clients won't understand. Things like, for example, if you're working in a small town or within a small community, it may be important to let the client know about the fact that you can't engage in multiple relationships or that you will avoid multiple relationships. Like, for example, I had a classmate who at one point was the only person in Houston who was counseling in Vietnamese. And she was also very active in the Vietnamese community here in Houston. So it was important that she talked to her clients about multiple relationships because it would be very likely that she would encounter these people in the community. So, for example, if I am your therapist, you can't also be my accountant. Explaining these things because clients may not know that they shouldn't solicit you for other services because that would constitute a multiple relationship. Your informed consent should also include a discussion of your qualifications and your background, so your education, your experience, your licensure. It should include a discussion of fees and the services that can be expected. So it's also important to let your clients know that as a psychologist in Houston or LPA, that you do not prescribe medication because sometimes they will not know that. So let them know the types of services that you do provide. You should discuss the expected length of treatment. So length of treatment overall, like I typically see my clients for, 6 visits, 8 visits, 2 years, whatever the typical length is. Also the length of each visit, how long you'll see them each time you meet with them and how often you'll meet with them. Any benefits and risks of therapy, let them know if you're under supervision and if their case will be discussed with colleagues or if you'll be doing any consultation. You should also address technology specifically. So how will email be used? Are they comfortable with exchanging emails? And if they are, and if that's part of your practice, you should keep emails to appointment info only. You shouldn't be exchanging information about the client's case or discussing clinical issues with the client through email. How voicemail messages should be handled. Specifically what number should you leave a voicemail? Can you leave a voicemail? What should you say in the voicemail? Some clients would rather have you say, "Hi, this is Stephanie confirming your appointment on Wednesday at 3, as opposed to this is Dr. So-and-so, because that reveals that they're seeing a doctor. So, discuss how they want you to handle voicemails, if you should even leave voicemails, and also texting. What is your policy on texting? And so your informed consent should be done in language that your client can understand, and also make sure that you're constantly revisiting your informed consent policy so they understand things they may have forgotten that you discussed at the beginning of the relationship. So an important part of the informed consent process is discussing the limits of confidentiality with the client. So it's important that we make a distinction between confidentiality and privileged communication. Confidentiality is an ethical concept, and it's the legal duty of the therapist not to disclose information about a client. So the responsibility for confidentiality lies with the therapist. And this is central to developing a trusting relationship with the client. They have to trust that you will keep their information confidential. Now, this is different from privileged communication, which is a legal concept. And this protects clients from having their confidential communication revealed in court without their permission. And the right of privilege is held by the client. So you as a therapist can't say that this is privileged communication and it shouldn't be read out in court. Only the client can claim that right of privilege, so they hold that right. And the laws regarding privileged communication vary by state, so make sure you know your state laws with regard to privilege. So when can confidentiality be broken? So of course it can be broken at the request of the client or their legal representative. So the client can always request that their confidential information be released. Now, when can you break confidentiality without the client's permission? When it involves the abuse of a child, an elderly person, or a dependent adult. When the client is a danger to themselves or a danger to someone else. When there's court action involved, so your records could be subpoenaed by the court system, and confidentiality is broken with third-party payers. So limited information about the client and the visits will be released to their insurance company if the insurance company is reimbursing you for your services. And so just like informed consent in general, it's important that you revisit these exceptions, especially if the client is about to potentially reveal some information that may need to be disclosed. You can remind them of these exceptions to confidentiality because they may have forgotten. So it's important that they know that, what you're about to tell me, I may need to reveal to someone else for your own safety or for the safety of someone else.